Hi, I'm Dr. Saepoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. Today, I am going to be tackling the topic of controversies in the dental industry. Now, a lot of these controversies have been raging for 150 years or 100 years or 50 years, depending on what it is. And most people know what some of these are, but there's actually quite a long list. As a matter of fact, any dental procedure that you would care to name, there's probably some disagreement within the dental field about how to do it or what materials to use or, the basic engineering of it or whether it should even be done. And so the controversy that is the most important one for you is the one that you're dealing with in your own mouth. Are you contemplating the possibility of a root canal, or are you looking at choices for dental filling materials, or you have material in your mouth and you're wondering whether you want to keep it there or replace it, which I refer to as upgrading to more biocompatible materials? And I'm going to just start with the biggest, most obvious one that we have, and that is mercury. Now, anybody that says they haven't heard that mercury is an issue in dentistry, I don't know, maybe you have never had to have any dentistry or have a filling or a family member that's had a filling.
You're considered a superhero.
Yes,
if you've never had any.
Yep. You probably have all 32 teeth and have never had any chips or breaks.
You're on this level, this cloud, this plateau. You're so far up there.
Fully healed in every respect, yes. So mercury, that's been in use for 150 years or so, and in fillings. And the name of the dental filling material is amalgam. And amalgam is roughly 50% metallic mercury. And it's mixed with 4 other metals into a little paste and put into the hole in the tooth, the cavity. After the decay has been removed, then there's a hole, and then we have to put something in there, or else you'll get food crammed in there and new bacteria will live in there. So we restore the tooth. So another word for a filling is a restoration. We restore the tooth to its proper shape and function. And the material of choice for a long time, because it's relatively cheap, it's pretty easy to use, it's pretty forgiving if the area gets wet while the dentist is working on it or any of that kind of thing. The mercury amalgam fillings will still pretty much work and stay in there. Now, the controversy about them has been about whether the mercury stays locked into the filling material. And about sometime around 1990, the American Dental Association actually admitted that the mercury does actually evaporate out of those fillings in very, very tiny little amounts all the time, 24/7. And what they said was that there's absolutely no proof that that mercury vapor has ever been tied to causing any specific disease or ailment. And therefore, they said, we're going to continue using it because we've been using it a long time, and we're going to use it until somebody proves that it's unsafe. And then all of the research that was done that has shown that the mercury that comes out of the fillings is really and truly mercury and really does go into your system and get absorbed into your body. That research was generally not published in the Journal of the American Dental Association, and therefore dentists didn't consider it to be important research, and it kind of got brushed to the side. But there's actually a huge body of research showing that mercury vapor really is mercury, and that it really is going into your body in very tiny, tiny little quantities all the time. And that's been shown, and as I said, the American Dental Association has acknowledged that. They've also said that the amount that comes out of the fillings just happens to be the safe amount that our bodies can tolerate. But if you talk to other scientists around the world, toxicologists or just anybody that studies mercury, chemists, whoever, the general consensus is that there is no safe level of mercury. And in fact, mercury has been, and that's mercury in all forms. It's true that there are some forms of mercury that are considered to be more toxic than others because they're absorbed more readily into your cells, such as methylmercury and ethylmercury, as opposed to metallic mercury, which is the form that it's in as it comes up out of the fillings. But the general consensus is that there is no safe level. The best level of mercury is 0. And so the methylmercury is the one that people talk about being in fish, that, watch out how much tuna fish you eat or shark or whatever, because swordfish, there are certain ones that are just really quite, these particular fish are called bioaccumulators or mercury accumulators, and they just accumulate it. They don't detox or get rid of it throughout their lives. And so when you have an older fish, it's going to be really quite heavily laced with mercury and probably other things. And that's methylmercury. It turns out that the bacteria in your mouth can also methylate mercury, which means that as the mercury evaporates off of your teeth, it's possible for the bacteria that are in your mouth at that time to go ahead and methylate that, which, of course, is rendering that mercury into a far more toxic form. And the other form of mercury that we can talk about is ethylmercury, which is the form found in thimerosal, which is in the vaccines. That's also considered to be quite toxic. And I'm not going to talk about vaccines, but I'm not really in favor of injecting mercury into people or inhaling it or swallowing it or getting mercury into your body in any form. I tend to agree with those who say that the best level of mercury is 0. So the mercury in the fillings, it doesn't mean you have to rush out and get it all drilled out of your mouth as quickly as you can, because there's quite a bit of exposure during the removal process as well. And that is one of the reasons why it's probably a good thing that, the industry has been a little bit slow to jump on, replacing all this stuff, because it's very, very important to go to a dentist who is going to be aware of the toxicity of it as they're removing it from your teeth. This is one of the areas where there's a lot of argument in the profession, because if you go to a dentist and you have it removed because you're having cosmetic dentistry done, and, mercury amalgams are not pretty. They are gray, or, sometimes they're shiny and silvery, and so sometimes they've been called silver fillings, but the silver is only 35% and the mercury is 50%, so as far as chemistry and labeling of products, it actually technically should be called mercury amalgam, not silver amalgam. And when this is removed from your teeth, whether it's because there's some decay or because you have chosen to upgrade to something more beautiful and more cosmetic, or because you don't want mercury in your mouth anymore and you want to upgrade to something more biocompatible, it needs to be taken out extremely cautiously. It needs to be done in a way that doesn't expose you to the dust or the vapor from that as it's being drilled out. And that's definitely a measurable amount, and it definitely is increasing over the filling and in your mouth as it's being drilled out. And so there are definitely some safe protocols, but there aren't very many dentists that take this issue seriously enough to use the protocols and to use them religiously every time. And those protocols are very well known in the holistic dental community, the natural dental community. Anyone who calls himself a biological or a natural or holistic dentist, you can ask them all these questions, and they will tell you, they'd be happy to tell you what all the protocols are that they're using to make sure you stay safe while it's being replaced, while it's being drilled out. And it also keeps the office air clean and protects the dentist and the staff from exposure as well. And it's just very, very important to make sure you ask those questions and have it removed carefully if and when you choose to have it removed for whatever your personal reasons might be for doing so. Now, I think we're going to be coming up here on a break shortly, and when we come back from the break, I'm going to be talking about fluoride next. And so this is DentalMD, and I'm Dr. Saepoff. My office is in Issaquah, Washington State. You can email at appointments@naturaldentist.com if you want to ask my front desk any questions that you might have. And you can also email questions@naturaldentist.com to get questions to me to consider answering on the air. And so we'll be back right after this break. I'm Dr. Saepoff. This is DentalMD.
Having trouble picking up the Alternative Talk 1150 signal? Well, whether you live in Portugal or Puyallup, Tasmania or Tacoma, India or Issaquah, you can get Alternative Talk 1150 programming streamed live on your computer via our website, 1150kknw.com. It's true. Just visit 1150kknw.com and click on the Listen Live button. Make sure you have an audio player installed that will play streaming MP3 audio such as Winamp, iTunes, or current versions of Real Player or Windows Player. Visit our website for more details. Remember, that's 1150kknw.com.
This is a remote village in Mali, West Africa. This is Salif Diarra, a local health worker. These are some of the 123 village children who survive life-threatening illnesses because of his efforts. These are the paths that Salif walks, sometimes miles each day, to visit all the sick children in his village. This is Minata, a mother who was afraid she'd lose her 4-year-old daughter to malaria. And this is Maimuna, one of the many children who got her joy back thanks to Salif's efforts. This is you becoming part of the story. You are one step away from helping local health workers like Salif make the good go even further. Visit goodgoes.org to see the many ways you can help. Brought to you by Save the Children and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Following the herd is fine until they lead you off a cliff. Think for yourself. Alternative Talk, 1150 a.m.
All right. You are listening to DentalMD on KKNW Alternative Talk 1150. I'm Dr. Jessica Saepoff, and I practice in Issaquah, Washington. And at my office, we are very careful about keeping our air quality very high. And in the last segment, I was talking about mercury. We're talking about dental controversies today. And I spoke at length about mercury and mercury safety and some of those issues. I want to mention one more thing before I move on to my next topic, which is fluoride. And what I wanted to say about mercury is that it is a heavy metal, and there are a number of other heavy metals that we know about. One of them is lead, and I just want to point out for people who may still be thinking, well, mercury, it's so common, everybody's been using it for such a long time, how bad could it be, in these dental amalgams? And I want to point out that in the toxicology lists of where they list from the least to the most toxic substances, on that list, mercury falls between lead and uranium. Uranium is more toxic than mercury, and lead is less toxic than mercury. Now, I don't think anybody would be okay with just a teeny-weeny little bit of lead exposure all the time. And so if you think about it that way, then you might rethink whether it's okay with you to have new fillings put in that contain mercury, and you might want to actually consider the possibility for your future health of not only not having any new mercury placed, but perhaps as you can afford it, or when you're ready and you decide you want to upgrade, that you go ahead and have somebody who will do it safely replace those fillings with something better. And that's especially something to consider for people of childbearing age that would consider getting pregnant and nursing, because mercury in your body does concentrate 6 times more in the breast milk than it does in your bloodstream. And all of these things that I'm saying, it's a good idea to just go right online and just Google this stuff or whatever search engine you're using, and just look and see what all these controversies are. We have the internet available now, and both sides of these issues and all the history involved can be easily found. It's really a fascinating thing to do. The controversies are much wilder and more heated than you can imagine. All right, well, let's move on and talk about fluoride next. Fluoride comes in a couple of different ways. The way it was studied back in the 50s, they studied sodium fluoride. And yes, for those of you who are scratching your heads and saying, isn't that rat poison? As a matter of fact, that compound is found in rat poison. But when it's very, very dilute and put in the water, then we don't consider it to be rat poison anymore. We consider it to be a fluoride water treatment to help prevent decay. And whether or not it actually helps prevent decay is what the controversy is about. It's been found that if you put fluoride directly on the teeth, it will make the enamel more acid resistant, which is going to make the surface less likely to develop holes from acid that the bacteria produce that live on your teeth. However, there are lots of other ways to make your enamel stronger besides fluoride. And one of those is xylitol, and another way to prevent decay is to not eat things or drink things that we know promote decay. And I think we all know what those things are. Refined food, sugar, the white powders, sugar, and other refined food. And, of course, keeping the bacteria counts in your mouth low is a good idea. But the fluoride that's put in a lot of the municipal water systems now is not actually sodium fluoride, sodium fluoride dissociates into fluoride and sodium atoms in the water. But the fluoride compound that's now being used in a lot of water municipalities is a fluorosilicate chemical, which is actually a pretty big molecule, and it doesn't dissociate in water that I know of. And it's actually a product, one of the waste products of aluminum processing, from what I understand. And that's being placed in the water and being called a fluoride additive for the water. Now, that chemical, to my knowledge, has not actually ever been tested to see whether it has any effect on your enamel or your teeth or your health. And so we don't really know what that does. We just know that it means that our cities and towns are paying for fluorosilicates to put in the water to call it, fluoride additive in the water to help prevent decay, and that the industry is actually being paid to hand over their waste rather than having to pay to dispose of it properly, because it is pretty toxic stuff in concentrated quantities and toxic in small dilute quantities as well, as it turns out. Decay is not caused by a fluoride deficiency any more than headaches are caused by an aspirin deficiency. And so I'm opposed to any kind of mass medication just on general principles. If somebody believes that fluoride is a good medicine to treat decay, that's fine. Give it to people who agree with that and want that, and only people who need it, who have decay, or who it's being used as a preventive, and that's one thing. But to make all of us drink that, I think is not okay. It's just, in my opinion, my philosophy, it's not okay to expose everybody to something to benefit a few, because even though many people get decay, it's just not fair to make everybody have to drink this chemical or to go out and spend money to buy water that doesn't have it. If you buy bottled water from Canada, it'll actually say on it how much fluoride is in it or whether it has fluoride in it, whereas in this country that labeling is not required. Another kind of fluoride is stannous fluoride. That one tends to stain your teeth, and it's a tin. It's a fluoride with tin, and that is supposed to be good for preventing sensitivity. And you can put that on the teeth, but there are lots of other ways to prevent sensitivity. And fluoride is fluoride. There have been some huge epidemiological studies done on fluoride, and some of the people that have done those studies have been reprimanded because their results were unpopular. But some of the most enormous studies have shown differences in health in communities that have no fluoride, are partially fluoridated, or are fully fluoridated at what are considered optimal levels. And the thing that is correlated with fluoride in a community's water are hip fractures in the elderly. And as it turns out, decay rates are the same, whether there's fluoride or no fluoride or partially fluoridated. And these studies are available. Again, go ahead and look these things up on the internet. You will be amazed. Part of why when we go on the internet we don't find these things is because we don't know what questions to ask. And so one of the points of this show, which is DentalMD, is to help you form some questions that make sense for you so that you can go out and get answers. If you don't know what questions to ask, then you're not going to get the answers, and these topics are not necessarily going to be offered, all this information. And that's one of my missions, is to make sure that you have all the information. I am here to shed light on these controversies, and I'm here to make sure that you have all the information you need before you sign an informed consent and have any treatment done. I'm Dr. Jessica Saepoff. You're listening to DentalMD. For anyone that has tuned in, we're on KKNW Alternative Talk 1150, and I'm talking about dental controversies today. Let's go ahead and move on. I think we just have a couple more minutes before the next break, and I'll just touch on the next topic that I'm going to cover, and that is root canals. Now, that might be something that you didn't even know there were controversies about, but that one's been really well swept under the rug by the profession, and it's been people who find out about this particular controversy tend to get pretty upset about it, because if you decide that you'd rather not have a root canal, you really don't have a lot of good choices in that case. The only other thing you can do with a tooth that has a pulp inside that has become necrotic or died and you've gotten an abscess, or maybe it died from trauma and it's not even infected, but it needs that pulp treated. If you decide you do not want to get a root canal, your only other option is extraction. And that seems pretty draconian. It seems pretty extreme. People do not want to lose teeth. There are a lot of good reasons not to extract teeth, and there are a few circumstances under which root canals are probably desirable, but not in every case. And I'm going to talk much more about that, more details, when we come back from the next break. And you are listening to DentalMD on KKNW Alternative Talk 1150. I'm Dr. Jessica Saepoff. We'll see you after the break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk 1150 a.m.
I'm in almost every school bus and classroom. I go to school with your children. We say the Pledge of Allegiance together. You've seen me around the neighborhood, and you've told me I'm a pretty good kid. Well, I'm one out of every 4 children in America, and I'm struggling with hunger. This problem is closer than you think. My teacher tells me we could grow up and be whatever we want. I want to grow up and be someone who doesn't go to bed hungry. There's enough food in this country to feed everyone. Please visit feedingamerica.org today and find your local food bank for ways to help. Every dollar you donate helps provide 7 meals for kids like me, quietly struggling with hunger. Together, we're Feeding America. Brought to you by Feeding America and the Ad Council.
You want to be up to date on the latest news, but you don't want to spend all day hearing about the minutia or spin. Well, now you can get the facts fast from the most respected name in news, CNN, with our quick updates at the top of the hour featuring the information you want, news, traffic, and weather without all the blather you don't want. So stick with Alternative Talk 1150 AM for your favorite shows and the information you need without all the baggage you don't. Alternative Talk 1150 AM, now better than ever. More choices, more topics, more shows, one station. Alternative Talk 1150 AM.
You ready? Okay. And welcome back to DentalMD. I'm Dr. Jessica Saepoff, and we are on KKNW Alternative Talk 1150. Today I'm talking about controversies in dentistry, and I've covered a little bit about mercury and fluoride, and I've moved on to root canals, which many people don't even realize can be controversial, but there actually are some arguments within the industry about root canals, and these have been going on a long time. There was some research done way back in the 1920s, which was ironically funded by the American Dental Association. And this research was conducted by Dr. Weston Price, and you may have heard of him because of all of his nutrition research, but he also did quite a bit of dental research on root canals and areas in the bone after teeth were extracted. And he even talked a bit about posture and airway and other related issues in dentistry that relate to the bite and the jaw position and all kinds of stuff. He was a brilliant and fascinating person. And so a lot of the research that he did, it's just tomes, just these huge volumes of research. And there was a guy by the name of George Meinig, an endodontist, that's a root canal specialist, endo meaning inside the tooth, endodontist, where the nerve tissue lives. And Dr. George Meinig wrote a book it's not a small book, but it's a summary of Weston Price's research on root canals. And the book is called Root Canal Cover-Up. And I read it years ago, and it's really, and this guy, I didn't tell you everything. He was an endodontist for 40 years, and he was very active in the conventional mainstream dental community. He founded a major organization and headed a major organization for the specialists, the endodontists, and I don't remember exactly what the title of that organization was, but I'm sure that's available online. And he found out about Weston Price's research, and he was so taken aback by all of this information about root canals after having done root canal treatments for patients for many decades. He turned around and exposed the controversy about root canals in his book by publicizing Weston Price's research. And this book is really easy to read. It is very cut and dried. He explains the research. He makes the points about the research. And it's just a really well-written book, very easy to understand. And it's really mind-boggling, the research that was done. But just to give you a quick overview of it, like really quick, root canal treatments, once they're done, the tooth is considered necrotic. It's a dead tooth. And somehow we've managed to allow ourselves to think about a dead tooth as being okay. We don't keep any other dead tissue in our body, but if you have a tooth that's dead, well, somehow that's become okay. And it is okay from a particular standpoint. And that standpoint, which has been the one that dentistry has been coming from on this, is that they go in, they remove all of the infection, they disinfect the canal, and note that I said disinfect and not sterilize. disinfect the canal, clean it all out, shape it, put a nice material down in there all the way down to the root tip. It looks great on an x-ray. It's all filled and sealed, and the infection in the bone below that tooth heals. It looks great on an x-ray. There's no infection to be noticed in any way. Just by looking at it, it doesn't hurt anymore. Great. Let's keep that. You can keep it. You can continue to chew with it. The gum tissue around it is healthy. Fabulous. Sounds good. But the research that Dr. Price did on these teeth showed that the bacteria that there are bacteria that continue to live in the tubules of the tooth, which are tiny microscopic channels that actually run horizontally. The main pulp chamber and canal are vertical in the tooth, and that all gets cleaned out real well. But those agents that go in and disinfect that canal cannot get into these tiny, tiny little microscopic tubules, which is where all of these microbes just continue to live. They're not dead. They're alive, and they continue to live off of diffused nutrients, and they give off their waste products, of course, like all living things. And those waste products just diffuse right out of the tooth structure and into your body. And whether or not those chemicals are toxic or harmful to your body, that's where the controversy is. How toxic are these chemicals? Are they toxic? Is it okay? Now, in dentistry, we were always told that the bacteria that continue to live in that tooth, that it's okay if there are a few in there because not very many of them can escape the tooth and get into your bloodstream where they could cause a problem because you have, if you're healthy, your bloodstream has white blood cells and you'll just get rid of those really quickly. And so it's not a problem. But is it? Because it's not just a few bacteria that escape from the tooth and get killed by white blood cells that we're worried about. It's just literally teeming with bacteria. And these bacteria are continually giving off their waste products. And so, again, the question is, are these waste products, are these chemicals harmful to you? So there is in the holistic dental community, we generally don't like the idea, and the holistic and natural medical community as well, generally frown on keeping anything that's infected, harboring it. It's basically technically a chronic infection rather than an acute infection. It was acute when you had the abscess and the swelling and the pain. Then the root canal got done and that all settled down and now it doesn't hurt anymore. But technically it's still infected because bacteria are living in that tooth. And so now it's considered just sort of a chronic infection. Well, in the holistic and natural community, we don't necessarily think that's a great idea to keep something like that. But on the other hand, let's say that tooth died because of trauma. You hit the tooth or you fell against something and that trauma caused the nerve inside to devitalize. That's not an infected tooth. That's a tooth with a dead nerve because of trauma. Maybe it's okay to get a root canal treatment on a tooth like that if it can be kept sterile, if it can be prevented from becoming a host to all of these opportunistic bacteria that would like to live in there. And that's another question, and maybe that's a good use for, periodic ozone therapy on that tooth to make sure it stays nice and clean. But I don't know everything about ozone therapy, and there are some people that are beginning to use it, and I'm looking into it. So for anybody who's just tuning in, this is DentalMD, and I'm Dr. Jessica Saepoff, and I'm talking about dental controversies today. I've covered mercury and fluoride, and now I'm talking about root canals. And so, as I was saying earlier, if you decide that you don't want to get a root canal, then your options are not very nice. Your only other option, if that tooth is dead, is to have it extracted. And missing teeth, losing teeth, that's really a difficult thing to go through, especially if you're young. Now, I'm going to mention one other issue associated with this, and that is when dentists are preparing teeth for crowns and onlays and drilling teeth, and they're going fast, they want to be very efficient, and they think that you want them to go fast and stay on time and get you out on time. And, they get in there and they're quickly removing decay and getting it all out. And after your treatment is over, you have a few days where instead of your tooth feeling better, it starts to feel a little worse. And, that dentist didn't necessarily do anything wrong, But maybe, just maybe, if these procedures are done a little more slowly and gently, and maybe the part of the tooth that's closest to that nerve is treated a little differently and maybe medicated or disinfected and a temporary put in to help remineralize that layer right above the nerve before a permanent restoration is placed. There are a lot of ways to sort of baby that nerve and try to make sure it stays alive even after a fairly extensive restoration has been prepared for that tooth. In my office, when I'm working with teeth, I do everything in my power to make sure that I do not traumatize that tooth while I'm drilling it or working on it. Because I know that a lot of people that come in an office like mine, Natural Dental Health Associates, they're pretty educated about all of these controversial issues. And they already have decided that if one of their teeth dies after it's been worked on, or it just dies because a cavity got too deep and the nerve devitalized, they have already decided that they don't want a root canal and that they're going to just go have that tooth extracted. So knowing that, I take extraordinary care and time to manage those teeth, especially if the decay is deep. And I'm really not sure every dentist is quite that diligent about it, because most dentists think root canals are no big deal. And of course, in the conventional dental community, they are considered to be no big deal. And so if your tooth dies and you need a root canal, they just say, oh, well, your tooth died, you need to get a root canal. Go ahead and make an appointment, or here's a referral to an endodontist, and go ahead and get that done, and then come back and we'll do a crown or whatever they're going to do with that tooth. So I just wanted to mention that it's really possible to be kinder and gentler to the teeth as we work on them. And so you may want to seek out somebody that's going to take the attitude that it is not okay for that tooth to wind up needing a root canal, and everything should be done to prevent that. So you are listening to DentalMD on Alternative Talk 1150. I'm Dr. Jessica Saepoff, and when we return from the next break, I'm going to talk about some other materials such as nickel and resins, composite resins, which can contain BPA, bisphenol A. We're going to talk about those issues when we return.
All right, class, let's hear what everyone did this weekend. Jill?
Well, I raised my older sister to a big oak tree. It was at least 100 years old. My mom said I must have set a record or something. And then we went down by a stream and perched up on this huge rock and saw all these little minnows swimming around way below us. And then I rescued my little brother from an evil slug king who was guarding him at the bush fortress. And my sister and I brought him back to our super twig fort for safety. And then we all laid out and told stories until it got dark. And the Big Dipper led us all the way home.
Wow. Awesome. Where were you, Jill?
Yeah. We went to the forest. It's not that far away. Anyone want to come this weekend?
Ask your parents to take you and your friends to the forest this week and find the fun, adventurous you. It's closer than you think. Check out discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk 1150 AM.
You probably know Alternative Talk 1150 AM is the home of great shows like Conscious Talk, The Scandinavian Hour, and The Truth About Nutrition. But did you know it could also be the home of your own radio program? If you have an idea for a radio program to promote your business or address the topics you want to talk about, call Eric Crema at 425-653-1150 and find out how you could join the Alternative Talk 1150 AM family. 425-653-1150 or visit our website at 1150kknw.com and click on Contact Us. Let your voice be heard on Alternative Talk 1150 AM. 1150kknw.com. Your connection to Alternative Talk 1150 AM.
Okay, I'm Dr. Jessica Saepoff. You're listening to DentalMD on KKNW Alternative Talk 1150. And today I am talking about controversies in dentistry. I have already covered mercury and fluoride a little bit and root canals. And I just wanted to mention again that less drilling is better. The less drilling, the better. Not just because it helps prevent your nerve from being traumatized, which can lead to pulpitis, which is pain and swelling inside of the tooth, and which that can ultimately lead to the nerve devitalizing or dying and the tooth being recommended for a root canal, which if you don't want a root canal, your only other option will be extraction, removing that tooth. And the other reason why the less drilling you do, the better, is because you can't replace that tooth structure. That is live tooth structure. That's a part of your body. And if it's in good condition, if there's any way to work around it and keep it and use it as, incorporate into the new restoration of your tooth, then that's how it should be done. It should not be removed for convenience of the dentist for whatever restoration they like doing for whatever reason they like doing it. And I can just mention that a lot of dentists have favorite procedures they like to do, or procedures that are quick and easy and that they can make a pretty good profit margin on. And they might tend to emphasize those procedures, especially if it's something they really like to do. Some dentists really like to do surgery. Some dentists love to do full mouth reconstruction and crown everything and make everything look gorgeous, wall-to-wall crowns, ear-to-ear crowns. And anyway, in my hands, less drilling is always the way to go. Now, if you wanted something cosmetic, of course, then, we will do that where necessary and where you desire it to be done. But it's always done in the most conservative way possible. Whatever techniques I'm using, they are the least toxic and least invasive possible techniques. And I'm continually going to continuing education to learn more conservative techniques, minimizing tooth loss for you, the patients. And as far as, root canals. All right, let's move on from root canals to, let's say your tooth dies and you need to have that tooth extracted. The next controversy that I'm going to talk about is called ischemic osteonecrosis. And this is another thing that I think Weston Price covered this in his research, but in any event, it's been covered quite a bit in a lot of research. And another way that you might look that up online, they're called NICO lesions, NICO. And they're neuralgia-inducing ischemic cavitational osteonecrosis is what that stands for. And you might have heard the term cavitation. I've even seen advertisements by holistic dentists saying that they will diagnose cavitations and treat them. Most people don't know what those are. A cavitation literally means a hole. And so when a dentist talks about cavitations, they're talking about holes in the bone, not your teeth. Cavitation versus cavity, but obviously it just means that there's a hole. And according to some of the dentists that have talked about these NICO lesions, after a tooth is extracted, if the ligament that holds that tooth in the bone while it's in there and alive and you're using it, if that ligament that holds that tooth in the socket isn't removed completely, it will create an impediment to the bone crossing through that empty socket and filling it in properly. And you can end up with immature bone formation and maybe even incomplete healing in that area. And these look like little areas on the x-rays. And dentists have the conventional training on these is, we'll see those in an x-ray and we'll look at it and say, oh, yeah, that's normal. I can see where you had a tooth extracted there. And, those are just like little bone scars, and it's fine to leave it like that. But whether or not that's really okay to leave those is controversial. And the treatment of these things, unfortunately, can be quite invasive. And so the dentists who don't agree that these are a problem get very upset with dentists who do treat them, because to treat them, you basically have to redo a surgery. You've got to go in there and clean these areas out and try to induce that to heal. When these areas are cleaned out, it turns out that if it really is an ischemic osteonecrosis, what's found on these samples for biopsy is basically reduced vascularity, which means not enough blood supply to these areas, and necrosis means dead. So they basically find these pockets of dead stuff, and this, just it's not nice. It's not nice to find dead gunk in a hole in the jawbone. Now, when osteonecrosis forms in other parts of the body, it's considered a fairly urgent thing. If you have osteonecrosis in your hip or, any other place, they basically go in there and do surgery. They schedule surgery. But for some reason, these osteonecrosis areas that can occur in the jaws are considered to be okay to just leave there. And as a matter of fact, if you ask most dentists, they will say these things don't exist. But in fact, there's very clear research and evidence that not only do they exist, but on biopsying them, it is found that there's necrotic debris found in these cavitational areas, in these holes in the bone. These are pretty common. These are pretty common, especially in the wisdom tooth areas. Now, when I said that they are called NICO, and I said that that stands for neuralgia-inducing ischemic osteonecrosis, cavitational osteonecrosis, neuralgia-inducing means that they can induce pain, nerve pain. So sometimes we have patients with pain, and we can't figure out what's causing that pain or where it's coming from. Most dentists will look everywhere except for NICO lesions. And it's understandable why they would not want to look for those, because of the controversy over them, and the treatment of them is considered unnecessary surgery by the mainstream community of dentists. For those of you who have just tuned in, you're listening to DentalMD on KKNW Alternative Talk 1150, and I'm Dr. Jessica Saepoff. I'm covering controversies today, and right now I'm talking about cavitational areas, cavitations, holes in the bone, which are ischemic osteonecrosis. And this is a very controversial area. It's been very difficult to get any kind of good instrumentation for checking these and testing to see whether surgical intervention is needed. It would be so great if we could find some way to have the body heal these, to induce the body to heal these through some kind of vibrational medicine. I am really looking forward to the future of medicine, which will be able to induce and speed up the body's natural healing ability, and hopefully a lot of surgical things that are being done now will become unnecessary. That is my hope for the future, and dentistry can move right into that future along with medicine. I'd like to see that happen. And medicine of the future, it's going to be vibrational and sound and acoustics and light frequencies, all kinds of new ways to correct what the cells are doing and remind the cells of what they're supposed to be doing so that they can get on with the business of healing. And then there's always mind-body connections, which means that your thoughts can impact how you heal, whether you heal. Now, I've talked about mercury, fluoride, root canals, and NICO lesions. And if you do lose a tooth, if you decide you're going to have a tooth taken out, and now you have a missing tooth, it's really important to know what your options are. A lot of dentists are very excited and maybe even a little pushy about getting people to get implants. They love doing them. Some dentists really love to do surgery, and they will just want to do an implant everywhere where you might be missing a tooth. And they will downplay other options. Implants are actually a little bit controversial because in the holistic community, people don't want a metal post permanently implanted in their bone necessarily, and they want to know what the other options are. But it's really like an artificial root, and it looks like a tooth, acts like a tooth, and the teeth on either side don't have to be cut or prepared for bridges and things like that. But bridges can be done very conservatively, and also there are removable options. Just like wearing glasses instead of getting LASIK eye surgery, a removable option is great. It keeps all of your other teeth from drifting and shifting, gives you something to chew on, and nobody knows about it but you, and you just take it out, clean it, put it back in. And they are actually quite great. And the materials available these days for removable partials and dentures are quite good and very biocompatible. Good choices are out there. And also that may be something that somebody might want to do for a year or 2 years or 3 years and save up money for a bridge or an implant if they decide they want an implant. But why get pushed into one if you're not ready or you aren't sure if you want one? So that's one of the controversies. It's just kind of a difference of opinion about how great or not so great implants might be. And there are different materials available for implants too. Most of them are still metal, and even though zirconia, which is a very hard oxide of zirconium, that's been developed and used for, it's a ceramic, and it's been used for implants. They've been using that in Europe for over 20 years. But in this country, it's considered new and experimental. And so it's difficult to find somebody that's experienced using those, although that's getting better over the last few years. And so whether you get metal or ceramic implants are still something that in the holistic community of patients, a lot of them are not so sure they want anything placed in and implanted in the bone, and they're also not sure they want a surgery done. Surgery is surgery, and if there's a way to restore that area and make it functional and comfortable without a surgery and without having to get medicines put in your body in order to have a surgery done and go through the healing process that can be uncomfortable, then they want to know what those options are, and I think that's reasonable. So you're listening to DentalMD. I'm Dr. Jessica Saepoff. This is KKNW Alternative Talk 1150, and I'm talking about controversies today. I haven't covered all of them, and we're coming up on the end of the hour here. There are more controversies that I'm going to talk about next week. I will finish up this topic. And what we're going to be covering next week is going to include TMJ and airway issues. TMJ is the temporomandibular joint, or the joint right in front of your ears, and that's affected by how your teeth meet. And also how your teeth meet is a function of where your jaw is positioned, and where your jaw is positioned affects your tongue and swallowing and airway. And airway is another big topic in dentistry, sleep apnea and other issues. And that kind of ties into orthodontics and structure and posture as well, so I'll talk about that. And I didn't get to my topic of nickel and composites and bisphenol A today, so I will cover that as well next week. And so today was our part one, really, of talking about controversies. And I'm Dr. Jessica Saepoff. This is DentalMD on KKNW Alternative Talk. Thank you. Talk to you next week.